Welcome to For Your Head Media. This is Miriam, nurse practitioner, and we're going to talk about chlamydia. What is chlamydia? Chlamydia is a sexually transmitted disease that is caused by a bacteria known as trachomatis. Okay, and what are some of the symptoms? For the most part, it's asymptomatic. What that means is that for the most part, it doesn't always have symptoms. In almost 70% of women, that they don't have any symptoms at all when they're infected with this bacteria. For some men, in about 50% of them do not have symptoms. But if you're lucky enough to have symptoms, the symptoms always come around the first to the third week of the infection. And for a woman, they might be having a vaginal discharge, itching, painful sex, pain when they urinate, stomach pain, and stuff like that. For men, they might have a penile discharge and some itching, and sometimes the testicles will hurt, and be an indication for them to go see a doctor. So what are some of the most common complications with this disease? It is a disease that causes pelvic inflammatory disease in women. It also causes infertility in both men and women. So a lot of times people might have it, they don't know until when they're trying to have babies, then they realize that, oh, wait a minute, they get checked and they discover that they have that. This disease, for the most part, is treatable. You just need antibiotics for 7 days and you're done. So it causes infertility. It could cause a child, a newborn, to have eye infection or sometimes eye blindness. So it has become so concerning to the extent where there's a mandatory recommendation that young people at the age under 24 and under should be screened for chlamydia, even when they do not have symptoms, because we are seeing the effect of this disease on the reproductive organs along the line. So they recommend that 24 years and under should be screened for chlamydia, and then 25 and up, should also be screened if they're having, have had just had a new partner or have changed sexual partners. They need to be screened because, again, this is a disease that is kind of silent, but then it has really deadly consequences for people. So what do we do when you get tested? When you go in there, let's say if you don't have symptoms, they might just get urine. But if you're having penile discharge or vaginal discharge, the first thing they'll do is get a swab of that, send it in. It takes about 7 days to get the report back. And then you get your antibiotics, get treated. The other requirement is that when you are getting treated, you must also notify the sexual partner so that it can also get treated. If not, you keep getting reinfection. And also, sometimes you start taking the medication within 4 or 5 days, you start feeling better, and then you want to stop. Do not stop taking the antibiotics. You have to finish it. And then within 3 months, they'll do what is known as the test of cure to make sure that the infection has cleared. And also, while you are being diagnosed, just remember that you need to get your sexual partners in the last 3 months to also get tested. And also, how do you take care of yourself? Make sure you are in a monogamous relationship or you're using condom all the time, because again, this disease has really bad consequences. In fact, it's a disease that is reportable to the health department here in the United States. That's how come we know that it's very notorious, and it's causing a lot of damage to people's, reproductive organs. So please get checked. If you're having symptoms or not even having symptoms, make sure that you check with a healthcare provider so that you get checked for this disease, because it's very treatable. Okay? Have a great day. Hope you enjoyed the video. Subscribe, like, share similar content like this. Remember, it's all about your health. Your health is the best asset you have. Have a great day.